Thank you very much. Hi, everyone. Bonjour tout le monde. Let's get going. Just go over the numbers. As you know, the numbers have been increasing up to about, on average, around 500 a day. They were 526 between yesterday and the previous day. And so we're starting to see those numbers go up. Again, the vast majority of those cases in Ontario are not vaccinated or partially vaccinated. Particularly the ones in hospital, looking at the hospitalization rates, out of the 57 or 58 in ICU, one was vaccinated, the rest were not. And so if you look at the Ontario numbers, again, at the local level, Ottawa has 20 cases, and then most of the cases in the GTA area as well, Hamilton, Toronto, York, Peel, and so on. In terms of our local numbers, we are starting to go down again. We had a bit of a peak last week where we had clusters of cases that brought our rates up. Happy to report that we only had 2 cases over the weekend and none so far today. And so again, our situation as well is the vast majority of the cases, again, we've had sporadic ones, were again not vaccinated individuals. Moving forward, that's what we're going to be looking at. At this point, our rates, we have one hospitalized individual who is a non-immunized individual as well. And so, however, we're not seeing, increased rates of admissions. Province-wide, the numbers are stable. The numbers are really not moving that much higher than the actual 500 per day, and so that is a good thing. Good thing. I'd like to have no hospitalizations, obviously, but when you're looking at what are the messages is when you're looking at out of 58 ICU admissions and 57 are not vaccinated or partially vaccinated, you'd think that if everybody was higher rate of vaccinations, you wouldn't have those 57 people in hospital, right? You'd get much less in hospital, and so that's exactly what we're trying to do as we move forward with sort of this last mile moving forward. So I want to spend some time now talking obviously about we're ready. We can do contact tracing. We can do that. We're not overwhelmed, so that's a good thing. We've had several Delta, I think 6 in general, in overall since the last couple of months of Delta. We don't know what the latest ones were. It takes several weeks for the lab to do the mutation, the gene studies. So at this point, we're just going to continue what we're doing. Fortunately, we've got a lot of active cases that now have been resolved, so less active cases in our area, and we'll move forward with regards to that. And obviously, we're still not there yet in terms of going to step 3, beyond step 3. And so I'll go over some of the numbers now to be able to give you a better idea of where we are with our numbers locally, and how we see our next steps of how we can continue to vaccinate as many as we can and anticipate perhaps some things moving forward. So I'm going to share my screen with you right now, and just go over our numbers, which in terms of percentage-wise really kind of mimic the Ontario numbers provincially. And so as of yesterday, we were at over 282,000 doses administered, 149,078 first doses, which is over 81% to 81.5% of the population, 12 plus, and almost 83% of the population 18 plus. We're 133,520 second doses, which brings us closer to that 75% mark for the 12 plus here. And you could see sort of when you look at the cases here, you can see the little blip that we had last week, which is again those cluster cases that we had. We administered, our rate of administration decreased a bit, summer and so on. So now we're up about 6,000 from the previous week. Looking at our age discrepancies, you can see that the gap is really narrowing now, which is very good. We're seeing bigger pickup in these areas here, and again, we're seeing some progress in the 18, less than 30, which is good. Again, we're hoping that we'll able to get some significant catch up and increase uptake in these two age groups, particularly as we approach the next couple of weeks, as we approach the fall months. Again, you can see that we're very high in the older populations moving forward. Again, just to point out, there's a bit of a discrepancy, particularly among the younger individuals. The female has higher rates than male. So again, it's the younger male cohort that we need to nudge a bit, and so they can get their vaccines, either go for their first dose and or go and then obviously go for the second dose. So this just gives you a bit of an overview of where we are with our vaccines. Like I said, we're at 282,598, and you can see that a lot of we had 73,000 in July. So far, we've got 11,000, which is a less of a rate than we had in the springtime in the past couple of months. You can also see that in terms of our first doses, we're up about 1,800, which is okay because we're increasing 150, 200 a day, which is good. You could see the little slight increase here, but that's good. We'll take that because we need to go in terms of our bigger numbers for the first doses. You could also see we've had a substantial increase over the last week between in second doses as compared to last week. So we're almost 5,000 doses more than we are, and we're at 73% right now of second doses. And the reason I say that is 75% is that benchmark that we talked about as we move forward in that regard. So again, we're heading upwards in the first doses, and we'll talk about some of our goals and what we need to reach those goals, like 85 and 90%. But again, we're inching closer to that 137,000 mark for the 75% at 133,000. So we need 3,730. We will get those this week, and we will be at 75% by the end of this week for sure, based on those rates. Again, I presented this last week, but I wanted to show you again the health unit in terms of our number of cases again from between July and December. Basically, breakthrough cases were very, very low. There were 24 out of 3,518 cases that we had. This is again the Public Health Agency data that I told you that overwhelmingly shows that the cases are these red are here unvaccinated or partially vaccinated here and fully vaccinated there in terms of cases. This is today's data in terms of the province, and you could see that about 20%, 21% of the cases were fully vaccinated, but you could see that a much smaller proportion were fully vaccinated when you started going into hospitalizations and when you started certainly going into ICU admission. So that's an important indicator for us. Again, I do expect to get cases. We do expect to get breakthrough cases, and I want to talk a bit about what that means and what we're seeing in terms of breakthrough cases and age groups as we move forward in that regard. This is the last mile kind of vaccination. I would like personally, and based on what we know about the Delta variant, that we should be way over the 85%, closer to the 90% mark of 12 plus vaccination. And I've just did a quick calculation here. Right now, our population is 183,000. That is 12 plus. We got about 25,000, individuals that are younger. But let's focus on the 183,000. So right now we're at about 149,000, which is about 81.5%. My first goal would be to go to 85%, which is 155,000, which literally is 6,000 more doses for first individuals. And I think we can do that. And that's what we're trying to do. And I will outline some of the things that we're trying to do now. And then going to obviously 90% would need about 15,000. I was speaking to a group of primary care physicians, and that's if you look at Prescott Russell and SDNG, like 7,500 per, that's not not that many people, and so I think that we can go and get those. But again, we need to have some strategic approaches for that. And now I want to address a few things. Number one is the fact that, again, we're seeing some breakthrough cases. Again, I need to underscore the importance of percentage of protection. So when an individual gets vaccinated, you can get what we say 85 to 95% protection, but there's still a percent unprotected. And in an elderly individual, particularly over 65, 75, 80 years of age, we know that the immunity goes down. The ability to create antibodies and to maintain antibody levels high enough to ward off further infection is diminished. So we see that with influenza all the time. So, and with other viruses. So this is not new. So what we're seeing is elderly populations are starting to get waning down of their immunity around the 4 or 5 month interval after their second dose. And we're seeing that by blood tests and tests that have been done in Toronto and others across Canada, looking at immunity, how long it lasts in those individuals as compared to other individuals. And we do know that the immunity wanes. In other words, the antibody protection, the level of protection that the vaccine gives an individual decreases as you get older. So it's not surprising that a lot of I would say the majority or a very high proportion of those breakthrough cases, those fully vaccinated cases that get infected are particularly in elderly individuals. So, but the good news is that we're seeing in most of those situations, although they get breakthrough infections, there's a very low rate of admission to hospital and very low rate of ICU admission and death. So that's what the corollary of what we're seeing. So, however, we are looking at scientifically looking at, do we need to give a third dose booster for individuals? So I know that that's something that's being looked at actively at this point in time, and perhaps under other populations, who have, again, immune problems, like people on transplant therapy, immunosuppressive therapy, cancer, and so on. But again, that's something that's being actively discussed. And I would not be surprised at all, as we move forward, that there will be again some addressing those issues about a third dose. And again, I'm talking about third dose because of medical reasons, because of either the antibodies decreasing in terms of persistence post second dose, or individuals unable to mount a very good response with the 2 doses because of immune deficiency in their systems. Now, one of the things that I just want to say as well as part of our strategy, that last mile strategy, obviously we're continuing over the next 2 weeks with our mass immunization clinics. But we have been working a lot. Our staff, our vaccine staff, and all of our staff are going out in the community and looking at a lot of pop-up clinics, and there's at least 10 or 12 that I've got here listed here with companies, Roxborough Bus Line, at Lazarus, Le Village, at Van Cleek Hill Fair, Ross Video, St. Lawrence College. There's a whole slew of them that we're doing pop-up clinics in addition to our clinics, and these pop-up clinics and specialty clinics will continue even beyond next week, because next week marks our last mass immunization clinic. Not to say that we're not going to have mass immunization clinics, but we won't be using the rinks for that. We'll be using perhaps community centers if we need to do that, and other settings for that. So, and also obviously with schools coming online, starting, we're going to be working again with partners. St. Lawrence College as well will be going there to providing vaccines, and we'll be working with our 4 school boards to provide vaccines at schools for students, for example, and even teachers that perhaps did not get their vaccines in time for school to start. So again, this is going to continue. And like I said, our magic number is that 90% number. I think it's attainable, but we need to, and in particular, we need more attention in the 30 and younger age group, because I think that's where we're going to have a big impact as well, because at this point, they are the least number, they have the least uptake of vaccine at this point. Bonjour tout le monde, je vais commencer avec le chiffre antérieur. Malheureusement, dans les je pense que ça fait 3-4 jours au moins, on est rendu aux 300, 400 là, on était à 526 cas, on était 511 hier. Augmentation quotidienne en Ontario. Je peux vous dire que la plupart vient de Toronto. On a eu 20 à Ottawa. Et je peux vous dire aussi que la plupart qui étaient hospitalisés, en effet, la plupart des cas étaient des cas non vaccinés. Et surtout, les cas à l'hôpital, la plupart étaient non vaccinés. Surtout, on voit aux soins intensifs, il y avait 58 patientes hospitalisées aux soins intensifs, 57 étaient non vaccinés ou partiellement vaccinés, donc une qui était totalement vaccinée. Donc, je pense que les chiffres parlent de l'importance d'avoir le vaccin et que la pandémie est rendue maintenant une pandémie vraiment pour les personnes non vaccinées. Chez nous, nous avons une patiente hospitalisée actuellement. C'est une patiente qui n'est pas vaccinée. On a eu 2 cas pendant la fin de semaine et ceci est moins qu'on avait la semaine passée. On avait quelques cas, on avait une douzaine de cas. C'était tous les cas reliés, c'était relié aux voyageurs aux États et aux autres pays. Bien sûr, la plupart encore, c'est chez les patients non vaccinés. Nous avons diminué nos cas actifs, heureusement, et on n'a eu aucune autre flambée ou extension des cas qu'on avait. Je pense que l'isolation a bien marché dans ce sens-là. Et aujourd'hui, on n'a aucun cas à rapporter jusqu'à date que j'ai commencé mon conférence de presse avec vous. Au niveau de l'hospitalisation, on voit que ça reste toujours stable, 100 patients hospitalisés et aussi le niveau aux soins intensifs, ce n'est pas au niveau que ça va nous déborder. Donc, c'est une chose à voir. Qu'est-ce que je m'attends de voir, c'est que même si on a des cas augmentants, le pourcentage qui vont être admis à l'hôpital va être beaucoup moins que si on n'avait aucune personne vaccinée. Autrement dit, les vaccins, la vaccination préviennent clairement l'hospitalisation, surtout aux soins intensifs aussi, et bien sûr les mortalités. Donc, ça, c'est le but que nous avons. Et pour l'avoir, on a besoin d'avoir un débit de vaccin un peu plus haut qu'on est actuellement. Et qu'est-ce que je vais faire maintenant? Je vais vous démontrer les statistiques locales au niveau des vaccins. Oups. Voilà. Donc, de date de hier, attendez, excusez-moi, daté jusqu'à date de hier, on a vacciné plus que 282 doses, on a donné et ceci représente 149,78 personnes qui ont reçu la première dose, soit 81,5 % de la population de 12 ans et plus, et 133 520 000 personnes 12 ans et plus, deuxième dose, qui représente 73 % des 12 ans et plus. Vous voyez ici que ici, c'est la ligne noire, ça, c'est les cas qu'on avait, puis vous pouvez voir une petite hausse de cas qui commence à diminuer dans notre région, et on continue, bien sûr, un petit plafondement ici, comme vous voyez, au niveau des doses qu'on donne. Toujours, on a une différence avec l'âge. Bien sûr, les personnes âgées, on a un très bon pourcentage de personnes âgées, mais on voit toujours que les plus bas sont les personnes en bas de 30 ans. Mais on voit que ça améliore. On voit surtout les adolescentes, on était à peine 53 % il y a à peu près une semaine. Donc on augmente pas assez vite que je voudrais voir, mais quand même, on augmente. Donc, ici, on voit la prochaine. On voit ici, ça, c'est les femmes. Ça, c'est les hommes. Vous voyez qu'il y a encore une différence. Les femmes ont tendance d'être vaccinées plus fréquemment que les hommes, donc surtout les jeunes hommes. Donc, on a du travail à faire avec cette portion de la population. Bien sûr, encore, jusqu'à date, on a donné 11 000 vaccins en mois d'août. Le débit est moins qu'on avait en mois de juin et juillet, mais quand même assez bonne. Ça représente à peu près 1000 par jour parce qu'il y a quelques jours qu'on n'avait pas de clinique. Au niveau de première dose, vous voyez qu'on fait du bon progrès. On a augmenté à peu près 1500 à peu près depuis une semaine qui est bonne. Donc, on continue à donner les premières doses. Comme vous voyez, c'est une très bonne chose parce qu'on voudrait aller plus haut qu'on est à 80,5 % de la population de 12 ans et plus. On voudrait aller plus, 85 et 90. Je vais vous en montrer tantôt les chiffres exacts. Et on voit ici, au niveau de la deuxième dose, encore, on a fait de bons progrès. On a augmenté de presque 5000 doses. Donc, on est rendu à 73 %. N'oubliez pas que les buts du ministère étaient 80 % première dose, 75 % deuxième dose, pour qu'on puisse aller de là, étape 3. On n'est pas là encore. Et aussi, en voyant les hausses des cas quotidiennes, ça ne me surprend pas si on attend une autre semaine, même si on approche ou on atteint le 75 % de deuxième dose de la population. Donc, vous voyez ici, on rapproche ici nos buts de 75 % pour la deuxième dose. Vous voyez, on est maintenant à 3700 doses à peu près de loin. On va l'avoir cette semaine, donc je pense qu'on va atteindre le 75 %. Mais comme je vous dis tantôt, je ne pense pas que il va y avoir une décision, mais je ne pense pas qu'on va aller tout de suite au-delà de l'étape 3, même si on est là la fin de semaine d'ici vendredi avec le 75 %. Et puis ça, c'est les mêmes chiffres qu'on voit à travers l'Ontario aussi. J'aimerais aussi parler un peu des cas, comme je l'ai démontré la semaine passée, la plupart des cas sont non vaccinés ou partiellement vaccinés. En effet, c'est un petit pourcentage de personnes vaccinées en total qui étaient hospitalisées. Mais ce que je voulais vous montrer, c'est que ça, c'est les statistiques ontariennes du Ontario Medical Association. On voit ici que, vous voyez, rouge et jaune ici, la plupart sont des patientes non vaccinées ou partiellement vaccinées. Et le vert, c'est les personnes vaccinées. Vous voyez avec l'hospitalisation et surtout aux soins intensifs, voilà, les couleurs vous donnent toute l'histoire ici que la plupart, en effet, 98 % à peu près des personnes hospitalisées n'étaient pas complètement vaccinées. Donc, ça nous donne une bonne indication que la vaccination provient des admissions à l'hôpital et aux soins intensifs aussi. Ça, c'est très important. Et qu'on voit que même si on a un pourcentage un peu plus élevé au niveau des cas, à long terme, c'est minime, mais ces personnes-là, quand ils rentrent à l'hôpital, ils rentrent moins à l'hôpital, ils rentrent moins aux soins intensifs, ils ne vont pas mourir. C'est une bonne prévention qu'on voit avec ça. Donc ici, on appelle de la dernière mille. Qu'est-ce qu'on veut atteindre pour notre population en total 12 ans et plus? En effet, en total, nous avons 180 000 personnes âge 12 ans et plus et on a à peu près 25 000 des personnes en bas de 12 ans. Actuellement, nous avons à peu près 149 000 doses de données à 81,5 %. Moi, j'espère avoir deux autres étapes. Une, d'atteindre le 85 %, parce qu'on sait que 85 et plus va nous vraiment protéger contre le Delta. En effet, ça va donner le community, on appelle ça herd immunity, immunité communautaire. Et ceci va prendre 6 000 autres personnes d'aller se faire vacciner. Donc, on n'est pas loin. Je pense qu'on pourrait l'avoir. Et 90 % ce serait idéal. Donc, on aura besoin de 15 000 autres personnes d'aller se faire vacciner. Donc, je pense qu'on pourrait le faire dans notre communauté et nous allons faire quelques étapes pour encourager et atteindre ces chiffres-là. Je vais juste parler, avant que je parle des moyens qu'on veut rejoindre ces personnes, je vais parler aussi qu'on voit il y a des personnes, bien sûr, avec le temps, qui, malgré qu'ils sont vaccinés, attrapent le COVID. Bien sûr, il y a moins de risques d'hospitaliser, d'être admis à l'hôpital ou aux soins intensifs. Et qu'est-ce qu'on voit? C'est que la plupart de ces personnes sont des personnes âgées. En effet, ça ne me surprend pas parce que même avec les autres vaccins, comme influenza par exemple, premièrement, le taux de protection n'est pas assez élevé chez les personnes âgées si on compare aux personnes de 40 ans ou 30 ans qui sont en bonne santé. Normalement, avec la protection qu'on voit avec COVID, c'est de 90-95 %. Même à ça, on a 5% qui pourraient être infectés, mais même à ça, ils ne rentrent pas à l'hôpital. Mais qu'est-ce qu'on voit, c'est que plus en plus, quand on fait les prises de sang chez les personnes âgées, à toutes les personnes, mais surtout aux personnes âgées, on voit qu'après une certaine période, 4-5 mois, le taux de protection des anticorps dans leur système commence à diminuer. Donc, on voit actuellement maintenant, on fait l'étude de est-ce qu'on a besoin de donner une troisième dose à cette population. Même chose qui arrive aux personnes qui ont le problème avec leur système immunitaire ou ils prennent des médicaments qui font la suppression du système immunitaire, soit les personnes de greffe, etc., ou les personnes qui prennent des médicaments pour cancer, etc. Ces personnes-là aussi ont de la misère à avoir des bons niveaux d'anticorps. Donc, soyez pas surpris à un moment donné qu'on va voir des différentes approches avec une troisième dose pour des raisons médicales pour ce type de personnes. L'autre chose que j'aimerais juste vous dire, c'est qu'on travaille, on a une autre 2 semaines des cliniques de massimisation aux arénas, etc. La dernière va être au 27 août. Par contre, on va continuer avec les cliniques dans nos bureaux et si on a besoin de faire un centre communautaire, etc., pour continuer à donner des vaccins. Mais on fait beaucoup de progrès avec nos commerces locaux, avec les agences locales. En effet, on a une douzaine des cliniques, des pop-up qu'on appelle, même il va y avoir, on va faire de différents commerces au collège de St. Lawrence College. On va aussi faire ça au Van Cleek Hill, le faire là-bas. Donc, on a différentes approches pour que ça soit disponible facilement, sans barrière pour les personnes qui pourront se faire vacciner. Ceci va continuer jusqu'à temps qu'on atteigne nos chiffres que j'ai mentionnés tantôt, parce que ça sera très important pour nous, pour notre communauté, d'aller chercher le 85-90% des personnes vaccinées. Donc, je suis très confiante qu'on va la tenir, mais ça va prendre du temps pour le faire. Et nous allons faire tout qu'on peut pour aller chercher les personnes, pour nous rendre là, chez eux, pour aller où ils sont. Comme ça, je pense qu'on va le faire. Ce n'est pas juste nous, c'est à travers l'Ontario qu'on a ce défi, mais je pense qu'on va l'avoir et ça va nous protéger. Faut dire aussi que, comme je l'ai dit tantôt, on n'est pas prêt pour aller en-delà d'étape 3, à mon avis. Je veux voir une stabilisation des cas et on veut atteindre le 75% et un peu plus. Et ça va être une décision qui va être prise cette semaine par le gouvernement en prenant compte des doses données et le taux des cas à travers l'Ontario. So I've got some questions here that I'm going to answer. I've got one from Nation Valley News. I said I had downplayed a little the amount of immunity conferred after infection. Would he acknowledge that the science is not settled on that? Yes, I will acknowledge that the science is not settled on that. I think I've said, Nelson, in the past that ordinarily there are viruses that can induce, with one infection, lifelong immunity, and there are others that do not induce lifelong immunity. The coronavirus group as a group is notorious for not being immunogenic. In other words, not being able to confer lifelong immunity with one infection. So we're looking at that, and I know and I'm very happy that the study of Nature suggests very long immunity results after infection, that antibodies are produced after a lifetime. Great, and that's great, because then obviously you have a lifelong immunity. But like I said, the reason that we're questioning, particularly with coronavirus, is the fact that we know that the coronaviruses themselves are not as immunogenic. In other words, they don't induce a natural immunity as much as other viruses, for example. I have another one here. Nelson, as you know, less onerous self-isolation rules apply. So when kind of reaches telephone. So the question has to do with so when an EOH contact tracer reaches out by telephone to a suspected contact in an outbreak situation, how will the EOH ascertain if the person is vaccinated or not? Very simple. We have COVAX. We can ascertain a person's vaccination status through our system COVAX. Am I worried about the federal election that has been called during the pandemic? Do you anticipate that it might lead to an increase in cases? Well, I think if they follow precautions, wear masks, get vaccinated and so on, I don't think that'll add to the risk. I know that there might be some debates and so on, but those could be controlled like any other venue during the step 3 precautions. Moving forward, I also think that polling stations and so on can be controlled in terms of lineups and so on from the public health point of view. Why, in your opinion, do you believe that there exists second dose hesitancy? What would you say to younger residents who have received the first dose and experienced side effects such as chest pains and the likes? Well, I can tell you that we have not had many side effects of myocarditis. I think we've had 1 or 2 cases reported in our area, which we're investigating right now. I think that unless you've had myocarditis, obviously, which is very rare in our area, what I would say is that some of the side effects that you have, we see all the time: people feeling lousy, muscle pains, aches and pains, and so on, and then they go away. And so I would continue advising people to go get their second dose. Obviously, if they have a doubt, discuss with a doctor. We look at the adverse effects, and I can tell you that we've administered 300,000 doses close to in our area, and I look at the adverse effects, and I can tell you the most of them that we see are really local reactions or reactions that occur several days later, which are our body mimicking an infection, which is what we wanted to do. So please, if unless you've had documented myocarditis or another medical reason, obviously, most of those side effects are not significant, and it doesn't guarantee that you're going to have them after the second dose as well. Have I received any information from school boards regarding how many staff members have received the COVID vaccine? If not, I'm not worried. I know that there are going to be mechanisms in place to be able to provide us this data. That's it, Jenna.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Hi, Philip.
The province announced today that there will be vaccine clinics in schools before and after the start of the school year for 12 to 17-year-olds. Do you have any details on what will be happening locally in the OHU?
Yeah.
And also, can you explain what would happen if there was a minor in that age group who wanted to get the vaccine but had a parent or guardian objecting?
Okay. First question is that we're working closely with our school boards right now. We have and I forgot to mention, part of our outreach is setting up school clinics. So we're working with the school boards and trying to see what the best way of doing clinics, what the best timing would be, weekends, after hours, and so on. So yes, that's full pin ahead. We have 12 of our nurses working with the school boards right now to be able to move forward. Secondly, if a child of who's eligible for the vaccine is under the gives the impression or the impression of the vaccinator is that individual can make an informed consent, then that informed consent rules.
Okay. So my second question was already answered previously by you. So my third question is not related to COVID-19, but is related to the boil water order in effect for South Dundas, the precautionary boil water advisory. That was issued around 11 o'clock this morning by the municipality of South Dundas after a water pressure issue that happened in Morrisburg yesterday from 9 to 10 o'clock p.m. That issue was about an hour, and there was about a 12 to 13 hour lag between the event and the advisory being issued. Is that normal? And does that seem like a safe thing to do considering the amount of water that's consumed, like in mornings and that?
It depends on the situation. It depends on that. I don't know all the details. I do know that it was issued. My staff let me know. It depends on the amount of pressure. It also depends on the amount of other tests that are done on site. So I can't really comment on that. I will look into that, but I can tell you that sometimes it varies depending on the situation, depending on what it is. If obviously we got results right away that had bacteria in the water, then you'd issue it right away. In other situations, we look at different areas and determine whether or not there was a significant decrease in the pressure. The reason we worry about the pressure is that if the pressure goes down, you may get leak into the system rather than because the pressure is low. And that's very rare. But again, I can't comment more than that, than give you that general response.
Okay, thank you.
No problem.
Our next question comes from Bill Kingston, Newswatch Group. Please go ahead.
Good afternoon, Dr. Paul.
Hey, Bill.
Hi. First question, the federal government announcing they're going to mandate vaccines for planes, trains, and boats. Do you anticipate there's going to be an uptick here locally of people getting the vaccine, or do you think you've got most of who you're going to be getting?
No, I think there are going to be measures not only federally, but also provincially at some point that are going to increase the demand. I'm hearing those things and we've asked for them. We've asked for example, increased uptake in healthcare workers, increased uptake, mandatory vaccines in healthcare workers, mandatory vaccines in educational settings, mandatory vaccines in colleges and so on. So yeah, we are anticipating that there'll be some decision at some point. And if that's the case, then there will be some uptake. And that's going to be part of that 10% I'm trying to get, actually 9% that I'm trying to get now.
Okay. And speaking of the 9% that you're trying to get, as far as second doses, are you seeing much of the vaccine brand shopping or people, and what have your supplies been like?
We have right now, Bill, we have both. So in most situations, we don't have an issue. I haven't heard much one way or another. We try to give people the second dose, which equates to first one. In situations where we haven't heard much, but it hasn't been much of an issue. Vaccine supply is ample right now. So before, when we had shortage of one, we had no choice. But in this situation, we're fine. Okay.
Piggybacking off Phil's question, we're literally 3 weeks away from the start of school.
Yeah.
You anticipate getting these clinics, because you said you're talking with the school boards right now. There isn't much time. Do you anticipate even getting them started before school starts?
We're trying to. We're looking at how we can get them going. What the logistics would be for us is not hard. I mean, we can do mass immunization clinics anywhere now. So we're trying to just figure that out. As a matter of fact, we have our group working on it right now with the school boards, trying to see where they could be. But like I said, I don't see why we'd need to do it at schools. If school's not open, we got all our clinics are walk-in. So if a parent is out there and considering it, just walk into one of our clinics. We have plenty of opportunity before school starts.
Okay. And my final question, just quickly, Akwesasne Department of Health announced a new case in their territory. It's not showing up in the statistics today.
Those are the two that we reported over the weekend.
I'm sorry?
We reported two over the weekend. They were from Akwesasne.
Oh, they were. Okay.
Yeah.
Okay, perfect. Thank you very much.
No problem.
Notre prochaine question vient de Samuel Blais-Gauthier, Radio-Canada. Pourrions-nous avoir plus de détails sur le nouveau décès rapporté aujourd'hui?
Pouvez-vous le répéter?
Pourrions-nous avoir plus de détails sur le nouveau décès rapporté aujourd'hui?
J'ai pas compris, Jenna. Le nouveau quoi?
Le nouveau décès.
Oh, je m'excuse.
Désolée.
OK. Oui, c'était une personne âgée, je pense 80 ans et plus, qui a subi de COVID, complications de COVID, je pense pendant le fin de semaine, le 13 août, était hospitalisé et est décédé. Donc, on rajoute un autre cas très, très difficile et c'est une personne qui était, parce qu'on se fait demander, c'est une personne âgée qui était presque totalement vaccinée, il avait reçu sa deuxième dose, mais pas dans les 14 jours. Donc ça, c'est triste.
Merci. Next question, James Morgan, The Review. Please go ahead.
Hi, Dr. Paul. I was
Hi.
wondering if you had received any information about an individual who
All
went to
done.
be
All done.
all taken care of.
Spoke to him personally.
Okay, great. Great. Anything else about that?
Just to you know that we go out of our way for people to share here. We had a complaint about an individual having a lack of handicap accessibility. There was an issue with one individual. I don't want to give specifics, but I can tell you though, James, that I had a very good talk with the individual, and I explained to him that this was a rare situation and that we take a lot of pride and a lot of time in looking at accessibility to all for our vaccine clinics. In fact, we do site visits to every physical location just to ensure that there are accessibility. As a matter of fact, we changed sites in Cornwall because the Civic Center wasn't really amenable to handicapped individuals. In Morrisburg, we actually, when I went there, I spoke to the mayor and we visited. It was really difficult to have accessibility from the front, so we opened up the Zamboni entrance so they can come in. Our staff go to cars sometimes if people can't come out of their cars. And I led the province with our home, searching out patients that are homebound to be able to go to them. So it was satisfactorily taken care of, and it was a real that complaint was the only one we've ever had after administering close to 300,000 doses.
Okay, thank you.
Okay.
J'ai une question. Denis Babin, Radio-Canada. C'est à vous?
Bonjour, Dr. Roumeliotis. Simplement pour revenir sur ce qui a été dit par Nelson et Philippe là, concernant justement la vaccination des élèves, simplement de nous parler justement de la teneur des discussions que vous avez avec les conseils scolaires et de la façon que vous entendez déployer justement la vaccination des élèves. OK.
Premièrement, nous encourageons les parents avec les adolescents de se faire vacciner maintenant. Nous avons, on a pas mal de toutes nos cliniques, sont sans rendez-vous, mais si une fois qu'on rentre dans l'école, et s'il y a des parents qui veulent faire vacciner leurs enfants, qui n'ont pas pris l'opportunité de se faire vacciner, nous sommes en discussion avec les 4 commissions scolaires à travers de nos infirmières. On a une douzaine des infirmières pour voir comment on pourrait les arranger, fixer les dates, etc. Soit qu'on fait ça après l'école ou le fin de semaine, etc., pour qu'on puisse rentrer dans les écoles. En effet, Denis, on est en train d'en discuter aussi, en cas qu'on aurait aussi l'autorité de vacciner les enfants, plus l'approbation plus que 5 ans. Comment on va rentrer aux écoles. Donc, ça fait une partie de toutes les discussions que nous avons. Mais bien sûr, la priorité, c'est d'aller faire et donner une autre chance aux parents et aux enfants 12 ans et plus de se faire vacciner sur place. Mais il faut dire qu'on a encore 2 semaines des cliniques auxquelles ils pourront aller sans rendez-vous.
Parce que justement, c'est un segment de la population que vous ciblez justement pour augmenter le taux de vaccination générale.
Oui, c'est pour ça qu'on veut considérer si, à un moment donné, si un parent ne veut pas aller à nos cliniques, je ne vois pas la raison pour laquelle ils vont aller à l'école si on fait les cliniques dans l'école avant le commencement d'école. Donc, une fois que les écoles commencent, peut-être si les enfants sont en place, les parents vont peut-être dire, OK, il n'y a pas de problème, on n'a pas besoin de se déplacer, etc. Donc, c'est pour ça qu'on vise de le faire une fois que l'école commence. Si on a une école qui nous demande de faire ça avant, on va le faire. Mais on a pas mal des places qu'on pourrait se faire vacciner avant l'école.
Merci, Dr. Paul.
Pas de problème.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you.